I am currently a professor of psychiatry and a founding faculty member at the Herbert Wertheim College of Medicine, Florida International University, which is Miami's public university. I grew up in the Dominican Republic in a home of immigrant refugee parents. And as a kid, I was, sensitive, but I was popular in school and I was successful academically. And by American standards, I guess my parents could have been middle class, comfortable middle class, but the Dominican Republic is not a very wealthy country. So we were surrounded by poverty everywhere, and this had an impact on me when I was a little kid. I went to a Catholic school, even though I have some Jewish ancestry, but those traditions were left behind a couple of generations ago. So my parents sent me to a Catholic school because it was the most, I guess, competent education available at the time. And 40% of the kids in my school were on scholarship. So I was able to interact with children from all walks of life. And I remember that in the second grade, my best friend had no plumbing in his house, and the bathroom was an outhouse. So that gave me a view of diversity from very early on. And these influences were very important growing up. The Dominican Republic is a predominantly biracial country, so oftentimes I was the only white kid or the whitest kid in the class. And this also gave me an opportunity to understand what it was like to be part of a minority or to be an outsider. And how I became interested in psychiatry, I was initially I wanted to be a writer and a journalist, and I was in my school newspaper. I was the youngest member of my school newspaper, and they had a contest, a short story contest, and I got the first prize in the short story contest. So the priest in my school encouraged me to become a journalist, but my father was very scared because this was the height of the Cold War in Latin America, and he felt that becoming a journalist would be tantamount to committing suicide at the time. So through literature, I became interested in human stories, and slowly became interested in psychiatry. And at the around 14 years old, I decided that I wanted to become a psychiatrist when I grew up. So I attended the Catholic University in the Dominican Republic, which had a very strong orientation to providing service. And we had very early on in the medical school, we had hands-on experience with patients. And during my internship year, I chose the rotation in the hospital that was the closest to the Haitian border. And there, a lot of the patients were Haitian immigrants that were undocumented, and they came from the most extreme forms of abject poverty. So I was exposed to these individuals coming across from a very poor country to a less poor country looking for a better future. From there, after graduation, I went to the University of Puerto Rico, where I did a medical and a surgical internship. And ironically, in Puerto Rico, I was then exposed to Dominican patients that were crossing from the Dominican Republic to Puerto Rico looking for a better life. And then, because Puerto Rico is an American territory, they could hop up on an airplane and go to the mainland United States. After that, I went to the University of Miami Jackson Memorial Hospital, where I started as a PGY2 in psychiatry. So when I arrived in Miami at Jackson Memorial Hospital, I was exposed to Cuban refugees fleeing communism, Central American refugees fleeing the civil wars in Central America, and then Colombian refugees fleeing the wave of terrorism in Colombia. So the exposure to immigrants and refugees was very much a common denominator in my career. Then after the University of Miami, I went to Cambridge Hospital, Harvard, to complete a fellowship in child and adolescent psychiatry. And there, I was the only Spanish-speaking person in the program. So I got assigned most of the or all of the Central American child refugees that were coming from the civil wars in Nicaragua and El Salvador. And so when I returned to Miami, I became very interested in the mental health issues of immigrants and refugees. I also wanted to mention that in my child and adolescent training, I had wonderful mentors. There were two individuals that really left a mark in my life, Robert Coles and John Mack, who I will always remember. And there were two very young at the time faculty members who were very helpful to me in helping me feel less intimidated in that environment. And they were Timothy Dugan and Kareem Munir, who continue to be close friends. Then when I returned to Miami, I ran the child and adolescent psychiatry outpatient clinic and the school consultation programs at the City Hospital, Jackson Memorial in Miami. And I continued to train. I got certified in forensic psychiatry and I did psychoanalytic adult training. And this has been, very helpful in my career. For several years, I worked in the juvenile and family court one morning a month, and I did evaluations for termination of parental rights, reunification with the parents after the parents had done parent training, and juvenile delinquency. But that work morphed into something very interesting, which was that many immigrants to South Florida came from very traumatized, violent backgrounds, got involved in crime, and committed murders in South Florida. So they would hire me as a mitigation specialist, meaning that once the individual had been sentenced for a serious crime, I would have to argue about the degree of trauma that these individuals carried with them, and then their sentence would be reduced. So that was, and I feel very happy that I was able to get about 3 people off the electric chair, or rather the lethal injection death penalty. And this was commuted to life in prison. I was very fortunate because when I got involved with the Academy of Child Psychiatry, I met David Pruitt, who was the president at the time, and Virginia Ginger Anthony, who was the executive director. And they were so kind to me and took me under their wing, and they assigned me to form part of committees. And that made me feel immediately a part of the organization. And then I met wonderful people that have served as role models for my career. And just to name a few, Clarice Kestenbaum, Ian Canino, Hector Bird, Marilyn Benoit, Robert Hendren, and many others. And one of the most important points in my career through the Academy was to meet my good friend and who I consider my older brother and collaborator, Andres Andy Pumariega. and an equally important friend, Rao Goganeni. And the three of us for the past 30 years have collaborated and written extensively on the mental health issues of immigrants, refugees, and members of minority populations. And I think we're very proud, and I can speak for Rao and Andy, that some of our work includes having developed the practice parameters for cultural competence, of which you, Cheryl, are also a co-author. And in addition to that, um, the book Immigration, Cultural Identity, and Mental Health, the Psychosocial Implications of the Reshaping of America, in which I am first author, and the World Association of Social Psychiatry textbook, of which Rao is the first author. So, but one of the highlights, and this is like the fun part of my involvement with the Academy, was that in 2003, the Academy celebrated its 50th anniversary. And the meeting coincided that it was in Miami Beach, where I live. And I was named head of local arrangements. And this allowed me to work very closely with Bennett Leventhal, Ginger Anthony, Christy Kroger, and Heidi Fordy, who would later become very important people in the organization, or were already important people in the organization. And the highlight of that meeting was that the incoming president at the time, Marilyn Benoit, who was born in the island of Trinidad, we were able to honor her by inviting a children's steel band that gave her welcome. By far, I would have to say that the um, most important moment, and I will have to make an effort not to get emotional, recalling this, was when I was able to work as a psychiatrist inside the U.S. Naval Base in Guantanamo. This is in 1994. It was very early in my career, and they needed a Spanish-speaking child psychiatrist. What had happened was the Soviet Union had collapsed and had cut funding to Cuba. This created a massive exodus of Cubans out of the island, and 37,000 people were rescued from the ocean by the U.S. Coast Guard and interned in the Guantanamo Naval Base, where they created refugee camps that were with tents. So I was given a leave of absence from work, and I was able to work in one of the two MASH hospital units, tending to, there were 2,500 children and adolescents, and they were slowly processed until all of them made it to the United States. But this process took an entire year. So there was a lot of suffering and trauma in those camps. And one of the wonderful things that happened was that among the refugees, there were a lot of Cuban psychiatrists and nurses, and we were able to incorporate them into our team. So the military, the volunteer psychiatrists, and the Cuban psychiatrists, we all worked together helping these children and adults. And in situations like that, uh, very strong human bonds are formed. Even to this day, 30 some years later, I still get together with those Cuban psychiatrists that I worked with in the camps, who are now living in the United States, and we reminisce about those times. Gotten a number of awards in my career, but I have to say that the closest to my heart was the military citation for civilian merit that I was given for my work with those refugees. In the past few years, I veered off a little bit from the academy, And I am now, along with Rao and Andy Pumariega, we are the three of us are past presidents of the American Association of Social Psychiatry. And now I'm the current president of the American Academy of Psychodynamic Psychiatry and Psychoanalysis, which is the affiliate organization of the APA that deals with talk therapy. But in both organizations, we intersect very closely with children and adolescents and the academy. And in addition to that, I've been very active in with two international organizations in particular, the Mexican Psychiatric and the Psychiatric Organization in the Dominican Republic. And both countries have significant problems with refugees. So this has been an important focus of the involvement. 17 years ago, by, question or a matter of chance in life, I left the University of Miami with a group of colleagues to start a new medical school in Miami, the first public medical school. And now, 17 years later, this dream has come true, and we have the Herbert Wertheim College of Medicine, the first public medical school in our area. And one of the tasks that I was assigned to do was to put together a course that could teach medical students professionalism, because there was a concern that empathy and patient care were really suffering, and that medical doctors have become distant and cold. So we didn't really have a model to go by, and we had to go find it in McGill University in Canada. But they were doing it at a resident level, and we were asking it to do at a medical school at medical student level. So we modified a little bit of the model and came up with our own model. And 15 years later, it turns out that now medical professionalism is one of the requirements for graduation in all of medical schools in the United States. So what we teach students are things like how to give bad news, how to deal with death and dying, how to offer hope to patients without deluding them, and how to prevent medical student burnout. And so, we're very proud to say that we got in 2018, we got the Edward B. Harris Award for Best Professionalism Course of All American Medical Schools. And when we looked at the awards, it was the second time it was given. And the first people who got the award were the people from McGill, who, who was the model that we took to start our course. So this has been a very satisfactory accomplishment, and I feel very fortunate to have been given that opportunity. One of the things I've discovered, Cheryl, is that, having passed the 60-year-old mark and moving straight on, it's very hard for me to do what I used to do, which was to work through the weekends, writing and reading and so on and so forth. So I try to at least have a day or a day and a half where I do absolutely nothing and clear my mind completely. And I try to, maintain some level of exercise. My new finding is bicycling, which is easier on the knees. And I used to jog, but I can't jog anymore. But bicycling is a good exercise, and it's a lot easier on the body than jogging. For many years, I was a passionate scuba diver. Just couldn't wait to get underwater and disconnect and go into that wonderful world of what's inside the ocean. But as I've gotten older, I think I have to be more careful. So I haven't scuba dived in a few years, and I'm trying to be more cautious. My big dilemma is that I have been very fortunate to have been able to combine clinical practice with academic work. And
Mhm.
right now I'm in the dilemma of I don't know what to let go first, the clinical work or the academic work, but I think maybe the clinical work might go first because I think that as we get older, we become the elders of the tribe, and it's almost an obligation to stay around to pass that on to the next generations of child psychiatrists. I have to say that I still have a lot of trouble saying no. But one of my goals is to get to the point where I can say no more often than I still say no. I have to say that I am so fortunate that I've been able to combine both academic work, involvement with organizations, and clinical work because academic work and the involvement with organizations is what has really opened the door to having access to mentors. Mentors are very important. I have had wonderful mentors, and their wisdom and their teaching lives inside of me. And every day when I go to work, when I have to go to the medical school and meet with the students or the residents, those mentors live inside of me, and I try to pass that wisdom on to the next generation. And this is really one of the most rewarding things about my career, probably at the expense of having made more money, essentially. To have a passion for what we do is very important. And I had a supervisor who told me that fortunately, in contrast to general surgery, or OBGYN, psychiatry is similar to golf. You know, you can play golf into your 90s because it's not a very physically demanding sport, whereas other parts of medicine are more physically demanding. And if you have a passion for what you do, I think longevity just comes with it. There are many things that I wish I was, I guess, oriented to, told, pointed in the direction of when I was earlier in my career. And, for certain points in my career, things were very turbulent, but I think it really has more to do with the changing times and how much medicine has changed in our generation. So I think that everybody was just dealing with the novelty, the challenges, and the not knowing where the profession was going. So I don't know that any wisdom would have made any difference because I think we were discovering things as they came along. I think that one of the most important things I learned in my fellowship was how to do child psychotherapy. And I chose the Cambridge Hospital program because that was the strength of that particular program. And one of the things that is really lamentable is that the pressure of economics has almost eliminated the possibility of psychotherapy with our patients, not only with children, but also with adults. And oftentimes I am asked, because I do the psychotherapy seminar and the normal development seminar for our fellows and residents, that the residents and fellows say, well, you know, psychotherapy is the most beautiful part of the profession, but will we be able to practice it in the current realities? So that is, I think, one of the challenges is how to maintain a psychodynamic perspective in the challenging economical times that we are living. Become involved with your regional organization, go to the annual meetings, try to meet people. Um, the more senior child psychiatrists are very eager to mentor young people. The Academy, I've been involved with a number of national organizations, but by far the Academy of Child Psychiatry does it the best. They have a very well organized mentoring program. They are very open to diversity, very open to new ideas, and very structured methodologically to mentor young early career psychiatrists. So please become involved with the national organization, go to the annual meetings, and become active in your local organizations. Very early on, when I was in seventh grade in the Dominican Republic, we were told at the school that Pedro Mir, the poet laureate of the Dominican Republic, was going to visit our school, and that all the kids who wanted to meet him could come and meet him in a small group. And so I went, and he was a very kind and gentle individual who made us feel, you know, very comfortable. And one of the little kids from the elementary school asked him a question. He said, have you ever written any poems for children? And he responded with a very psychodynamic answer. He said, when we are the children have a very special way of looking at the world. And as we get older, unfortunately, we lose the capacity to see the world through the eyes of a child. And then he paused a little bit and he came back and said, but I have written my best poems when I have felt like a child. And what I conclude from that, many years later, I have thought about that over and over, is that children have a very special sensitivity, and they are able to trust, to love, and to hope unconditionally. And child psychiatrists also need to have a very special sensitivity to be able to connect, to understand, and to protect that sensitivity in children. So I cannot think of a more meaningful and important profession than child psychiatry.